ரெண்டு ஜிபி போடு. ஆமா, அது ஒரு கால் கால்ல ஒரு கால்ல ஒரு கால் போடுறல ரெண்டு ஜிபி போடு. அப்ப இரு சித்தி உக்காட்டான். ஸ்டார்ட் பின்னாடியா?
Hello. Hello.
Good morning, ma'am.
Yeah, good morning. Can you hear me?
At last we got you online.
Yeah, okay. Chamundeshwari, Muttamil, I shared only 2 slides. Those 2 slides you shared.
We got it.
Okay.
We'll display. We'll
You can crop it if you need the second one. If possible, otherwise you can show it like that only, no problem. Can we start?
Yes, ma'am. Happy and delightful morning to all on a now gathered here. We don't have a house without foundation. We don't have a hospital without nurse. To lay a strong foundation for the upcoming nurses, we all are gathered here. On behalf of the Nightingale College of Nursing, I would like to welcome you all for the Nurses Day celebration. International Nurses Day is celebrated around the world every May 12th anniversary of Florence Nightingale birth. On 1998, May was decided as the annual National Student Nurses Day. First and foremost, I welcome our student president, Mr. K. Paviers, and the nursing for student of Nightingale Mission to present the welcome address. I welcome you, Mr. Paviers.
Good morning to all. Honorable Chief Guest, Principal, Teachers, and my dear students. A very warm welcome to you all at our Nurses Day celebration. Today, I am very happy to tell you that our college is celebrating Nurses Day even in this pandemic. All the peoples of our college have an equal effort behind the success of our college, because only by working together, our college gets succeeded. And it is a chance to celebrate nurses and their contribution to the health of society. Before starting the program, I would like to welcome all our chief guests. First of all, I am glad to welcome Dr. Rebecca Samson, Director of Nursing and Research, Arubadi Medical College and Hospital, Puducherry. I welcome you, ma'am. It will now be the turn of welcoming Dr. G. Muttamil, Principal of Nightingale Mission College of Nursing, Puducherry. I welcome you, ma'am. Next, we look forward for the presence of Dr. R. Kanagavalli, Principal of Zuleika Nursing College of Mangalore. I will welcome you, ma'am. With the equal pleasure, I would like to welcome Dr. T. Sivabalan, Principal and Dean, Pravaran Institute of Medical Science and College of Nursing, Maharashtra. I welcome you, sir. And I am welcome our non-teaching faculties and all our students of BM Con Puducherry. Once again, I welcome you all.
Taking the first step is always not difficult, but once you thought everything else was in place and you begin to wonder why you were scared of taking that step. For taking such steps in nursing, Eric was a leader of the young one who proves it quite. A true leader has the confidence to stand alone, the courage to make the tough decision, and the compassion to listen to the needs of the others. She doesn't set out to be a leader, but becomes one of the equality of her action and their intent. Best Citizen of India Award 2015 by International Publishing House, New Delhi, India. Dr. APJ Abdul Kalam Gold Medal 2015 by Global Economic Progress and Research Association. Florence Nightingale Award 2016, Lifetime Achievement Award, Society of Midwives in India, October 2016. The prestigious National Florence Nightingale Nurses Award 2016 from Honorable President of India. Lifetime Achievement Award from Society of Midwives of India on October 7, 2016. Best Education Award from the International Institute of Education and Management for outstanding achievements in the field of education at New Delhi on 15th February 2017. Here I'm glad to welcome you another inspiring person in the nursing profession, Dr. Rebecca Sampson, Director Nursing and Research area CH, and to give a president address. I welcome you, ma'am.
Thank you all. Good morning. Can you hear me?
Morning, ma'am.
Yes, ma'am. Good morning, ma'am.
Okay. So I'm glad to be with all of you today, and you made it to celebrate Nurses Day 2021 in spite of all this pandemic crisis. And first of all, would like to congratulate the SNA and also the SNA advisor, the principal, and all the faculty who had been support to all of you. And also thank you for inviting me to say a few words at this special day. And I have two things to say, not taking much time. One is, as we are celebrating Nurses Day, International Nurses Day, two things, nursing and a nurse, that's all. Okay, so I would like, I want Dr. Samundeshwari to share the slides. Just 2 slides. The first slide. Does not come.
Screen share it. We share the screen, ma'am. Ma'am, it is visible, ma'am.
No, not yet. I'm seeing all like a desktop.
Now it is visible, ma'am.
No, ma, no. No, I'm seeing only the desktop icons. Yeah, now. Yes, thank you. Thank you. Now I just want everyone to look at this slide. For ages, we have been learning nursing as art of nursing. It's an art. So this art is the hands that turn caring into action, the touch that turns compassion into comfort, families that turn love into healing. It has a great and a deep meaning. So I am sure many of you would have received this as a wish for International Nurses Day. So when I started my nursing, I learned the department as a nursing arts. The department is named as nursing arts and the subject also nursing arts. Later, the vocabulary changed to foundations of nursing, then nursing foundation, now fundamentals of nursing. Okay, so with the varied names, but what it means, nursing is an art where your hands had to be used. And hands, the heart, and the head, all three should be used, because nursing also referred as science and arts. So that's why the 3H concept is in force now. Wherever we go, you have to have the 3H concept. H is representing head, H represents heart, H represents hands. So head is for intellectual learning, the knowledge, the concepts, okay, the scientific rationale, the scientific principles behind your actions. So everything should be learned as a cognitive aspects. That's why we teach theory and also take you for practice. And we follow these demonstrations, re-demonstrations, written demonstrations, clinical practice, everything to develop skills where you can use your hands for healing touch. Okay, then comes heart. The heart is for compassion, to feel with, okay, to be empathetic with others, not sympathy. Sympathy is ayo pavam, then you don't do anything. But empathy is to feel with others who are suffering with the illness. If I'm in that place, if I walk in their shoes, how will I feel? That is compassion, to do with the heart, the attitude. Then comes the hands, as I said, the touch, not standing at the foot end and taking down the notes and writing, recording, documenting. Many times we go unethical also, because without doing, we are not supposed to record, document the care that we give, but we have to record only after doing or after giving the care. So in simple, the nursing is science and arts, both. So here, all 3H is included: the head, the heart, and the hands. So I hope all of you will understand. During this Nurses Day celebration, the 3H concept should not be forgotten. Next slide, please. Next slide. Not seen, not seen. It has not come.
Once again, ma'am, she's cropping the image.
Okay, okay.
Can you able to see, ma'am?
No, no. The icons only come in.
No?
Yes. Thank you. Now, is it visible? Can you all see?
Yes.
You can expand. Now we have seen what is nursing, understanding nursing. Now coming to nurse. Who is a nurse? Why did we come for nursing? Are we all proud to say we are all nurses? What is the meaning of nurse? It is another word to describe a person strong enough to tolerate everything and soft enough to understand everyone. Beautiful definition. I like this very much. If I am a nurse, I should be able to be strong enough to tolerate everything, whatever comes on our way. During this, especially pandemic, everyone is asked to do 2 shifts, 3 continuously because of shortage. And we are forced, we are expected to sacrifice many things. our self, family, our personal needs. And that's why the nurses are, the World Health has given the declaration that 2020 is a International Nurse Year of the Nurse and Midwife. Because we are expected to tolerate everyone, whatever comes on our way. Then soft enough to understand everyone. If you really start meditating upon these two words, start thinking about these two words, everyone will have to really re-examine ourselves, the oath that we have taken, the pledge we have taken, that we are here to dedicate our services to mankind. But many times we fail in this. We lose our patience, will become intolerant for many things in our various positions that when we are in, whether we are at bedside nurse, as a bedside nurse, as supervisors, or as teachers, or as administrators, or as researchers also. In whatever role we take, we somehow, sometime or other, we tend to lose our patience, and we become intolerant, either with the situation, either with the time, or either with the person or place even. So these four aspects we have to keep in mind and understand everyone, whoever we are working with, the persons, the team, whether it's a nursing team or our colleagues, other health team members, whether doctors or paramedicals or anyone with whom we are collaborating with for the patient care or for the students or during training period. So we have to be tolerant. And many times as a teachers, even when we are guiding the students, we may lose our patience. We may not understand everyone in their perspectives, what other person is thinking about. So this happens only when we are thinking only about ourselves. But as a nurse, we have to understand everyone with whomever we are getting associated with. So this is a beautiful definition of a nurse. It is just another word for nurse, is to describe a person strong enough to tolerate everything and soft enough to understand everyone. So these two words, I wanted to emphasize the nursing and the nurse during this International Nurses Day celebration. So because as a students and faculty, we are remembering this great day, and in the name of our founder, professional nursing, that is Miss Florence Nightingale, who has invented the professional nursing to be independent and to be scientific, to have our own job functions and to have everything what is expected of us to serve mankind, whether they are ill or well, whether they are in the hospital or in the community, wherever they are, whether individuals or families or aggregates. With everyone, we have to understand. I would like to complete or conclude my talk saying one small story. There was a man who was nurturing a dog, okay, a pet dog, okay, a master and a dog. They were living together. He was always, there was no one with him except this pet dog. So the pet dog was taking care of him so well. Whatever was instructed to him, he was doing by the master. Okay. So I'm referring the dog as he, right? Okay. One day, the master has given the list of things to be purchased or to be fetched from the shop, grocery shop. So he has given the money and he has given this chit or the list of groceries to be purchased and a basket. Okay. So he took the all three and went to the grocery shop and then gave it to the shopkeeper, the list, and he filled the basket with all the groceries according to the list. And the dog gave the money. He has given the change also. He put in the basket along with the groceries. And then the dog took the basket with holding on to his mouth, and then started going back home. The shopkeeper was astonished to see how intelligent this dog is. Then after reaching home, the dog, what he did, he found the door was closed. How will he enter the house? So he started pressing the bell. The dog started pressing the bell, doorbell, and knocking at the door. The master of the house came out and then he started beating the dog. Dog didn't understand for what. Then he said, "Why did you disturb me from sleep? You could have just opened the door. Why did he disturb the master from his sleep?" But finally, the moral of the story is, instead of being grateful to all that the dog has done for him, going all the way to grocery shop, getting all the things for the master, and because the door was locked, he need to knock at the door. Then he felt his sleep was disturbed for small little thing. He started beating the dog. So here what we have to learn is, what is our understanding, how tolerant we are towards the action of others. So here it's a real touching story. Though it's a story, there's a moral value. Because many times, whatever we do, people may turn as ungrateful. When small little thing goes wrong, we may be blamed. But all that is done by us may not be acknowledged. But we have to be strong enough to tolerate and understand everyone, and so that everyone will in turn understand us. It will not go unnoticed. This is what we have to learn. So on this Nurses Day, I want every one of you, the students as well as the faculty and those who are listening, and also from outside, I want to wish everyone a very happy Nurses Day and pay honors to our nursing profession and respect our nursing profession and carry on the torch that we have lit during our lamp lighting and the light which is passed on to us by our seniors and the founder of nursing, so that we will be igniting our light to everyone who go through our hands. And all of us know the light is a symbol of knowledge. Light is a way to our life. We cannot walk in darkness unless, even if it is dark, we try to take a torch, or we have a mobile facility. We put on the mobile and try to put on the torch, which is given as a provision in the mobile. So nobody likes darkness, but intellectually, the darkness is our ignorance, unable to understand. So we need to understand, people need to be tolerant, as Florence Nightingale has already showed us the path. So I want to wish each and everyone a blessed Nurses Day during this pandemic, and to be tolerant and to understand everyone, do our best. All the best and congratulations.
Thank you, ma'am, for your informative speech, and thank you so much, ma'am.
Thank you. Thank you all.
Next, I would like to extend my warm welcome to our beloved principal, ma'am, Dr. G. Mutamalachevi, to share his madam's way on personalized care. We welcome you, ma'am.
Very good morning to one and all gathered here. Madam, very good morning to you.
Good morning. Good
Definition
morning.
of a nurse which you have given, I too liked it very much. I too have taken the caption for my first slide. So, the definition which was liked by everyone, every nurses definitely will like that definition. Because we were like that. We were in time tough enough, and in time we will be an understanding person to everyone. So
Yes,
I like it so much, madam, and I would like to thank everybody to join in this forum and to come for sharing our knowledges. And I would like to thank the organizing committee also. Though it is a bit late to celebrate this Nurses Day, International Nurses Day, and our SNA is committed to celebrate this one every year. But last year it happened we were not able to celebrate because of the pandemic. We thought this next year pandemic won't be there, and this year again the pandemic has gone to another extreme. So, but we were really learned to live with that pandemic now. So our work schedule was not interrupted anywhere, and we are moving along with the schedules. So that this program was planned today. And also I would like to thank Dr. Kanagavalli and Mr. Sivabalan to accepting our invitation and to ready to share their views on this particular themes which is given to them. The nurses have always played a crucial role in recovery and well-being for people across the globe, but they hardly receive any respect that they deserve it. So this is the day which is dedicated to honor them and respect them, which they deserve it. This pandemic situation has a greater significance of International Nurses Day than ever. As the nurses are continuously providing services to the patients, being the backbone of healthcare system in hospitals. Their diversified role is to carry out several tasks at workplaces, where the International Day has come into force in the year of 1965 by the International Council on May 12th. Since then, it is celebrated on the account of birth anniversary of our English nurse, a social reformer, or a statistician, even we can say the famous Florence Nightingale. And every year, the International Council is announcing some of the themes or the concepts. Based on that, the whole year will be the services were molded to the public. This particular year of 2021, the theme announced for the International Day was to lead a vision for a future healthcare. Where doctors, other healthcare workers, nurses are in forefront fighting COVID-19 pandemic. So they are dispensing comfort, compassion, and care without even a prescription. When we had an idea of celebrating this Nurses Day, our SLA advisor had thought of searching some other concepts or themes on the same idea of nurses' voice to lead. That is the future healthcare. When we were thinking of Vision 2030, we got some of the concepts from the Scotland National Health Services. They have already in the year of 2019, they have passed some concepts towards the public, and they have received the issues and challenges of future nurses and the trends which they are going to serve for the people. Based on that, the National Health Services have brought some of the themes. Out of that themes only, we have got some themes here. It is a personalizing care and the promotion of caring and compassion, and the technology is enabled care. These are all the concepts which we got it from the National Health Services of Scotland Commission, which they started in 2019, and they have prepared an action plan, and at the same time commitments and the concepts, like what are all the concepts they're supposed to move forward with that. So based on that, we have decided to go with this. If not with the total action plan of Scotland, we can't adapt it, so that the concepts are similar and the same, which can be adapted or which can be implemented to anywhere in this world. So that we have taken, these are all the themes of personalizing care, preparing nurses for future needs and roles, and supporting the nurses along with the other two concepts which the Dr. Kanavali and Dr. Singapal will be dealing with. So this is what the definition which Dr. Rebecca Madam has given already, and she has given a beautiful explanation also. So the personalized care, the topic which is given to me is personalized care means a shift in relationship between the healthcare and the healthcare professionals and the individuals, which recognizes the clinical expertise of an individual, at the same time the expertise of the health professionals. Whereas this particular care, if you are taking into account not only the expertise and the experience of an individual, but it's taken account of their values and preferences also. Personalized care will be a shift, or the care can be provided more than millions of people in 2020. So it is an estimation by the Scotland, but we also can have an assumption, or we can assume that our care also supposed to reach millions and millions of people. Rightly, we are experiencing with the pandemic. So this definition for this personalized care describes a way of working that enables the individual and clinicians to work together to deliver care that is realistic, sustainable, and appropriate for the individual. It says very clearly that the care what we are going to give, either the clinician or the nurses, one who is going to give, they are going to work together along with the professionals or the individual, one who is needing the care. But that should be a realistic one, and that should be carried out for some more time. It should be a sustainable, need to be carried out for some more time, where the care continuity will be there, and which is appropriate for the individual need also. Also, it refers to the process by which people with long-term illness or conditions receive support that is tailored to their individual needs and wishes. Always the long-term illness people will be having continuous trauma and stress and strain, and that is considered here with their individual needs and wishes.
Extension.
There are few other terms which can be coined over here. What is the personalized care plan? When we talk about the personalized care alone, it can be implemented immediately, as it is told, realistic, immediately, and continuity of the care. When you think of it, should be a care plan form. As we nurses, we all know to write the care plan, and how far the care plan is planned, how many aspects were included, and how many days, how many weeks, even a month the plan is prepared. So the personalized care planning is essentially about addressing an individual's full range of needs, taking into the account of their health, personal, family, social, economic, and educational, mental health, ethnic and cultural background and circumstances. So you can see that all these aspects which is included here, on not only the health, their personal aspect, and their including the family, society, and as we have some other 7 aspects here, also we have some of the aspects.
Excuse me.
Okay.
Excuse me, I'm Kanavali.
Is this slide visible now? Okay.
Yes, ma'am. Yes, ma'am. It's
Okay.
visible, ma'am, now.
Okay, right. So the personalized care plan, which includes all the aspects of the individual, family, society, including their educational and economical aspects and the mental health also. The next term is a personalized health plan, which we were talking about the care plan first. Now it is another term which we are going to preferably use here as personalized health plan. It's a key feature of personalized health care as it anticipates the individual's specific health needs and develops a coordinated means to achieve them. We know very well the health plan, it says it is not only for the individual, again we'll be grouping it out to the family, indirectly it involves with the societal health need. So overall planning which may be matching it into the national health plannings. And next one is, what does personalized service means? What type of the service it is? How we are going to mean that personalized service? It's a customer-oriented service. Always now the nursing care is marketed, and not only the once that newer terms of IIT people came into the force, and we started to say that in the individual patients, then clients, now they have become a customers, and our hospitals have become industry, and our care what we are providing is going to become a customer care in future also. So personalized customer service refers to delivering customized services to cater to the exact needs and wants of the customer. This way the customer can feel more connected to your company, or the company in the sense it is more connected to your industry or your hospital or your healthcare setting. Also, because the customers receive tailored mood solutions to their problem, it leaves them with a sense of satisfaction, because every customer is considered more important to their individual needs, values, the preference we are considered, and we are going to involve them in the solutions or the action taken. In a way, it's going to give a sense of satisfaction for those individuals. And the concepts behind the personalized care. There are some concepts which we have to concentrate on while talking about the personalized care, which it represents a new relationship between two people. Or instead of saying two people, you can say professionals or a healthcare system people along with the individual, family, and society. So there should be a proper professional relationship planned in between the two parties. So it provides a positive shift in power and decision making. Always earlier we used to prescribe or we used to implement some of the procedures, and later on it was taught to us to involve the patients in your planning or the decision making. And when we go for an insurance part and all, it is decided to involve your even a family members to make some of your healthcare plan decision makings. So it is a smooth and soft shift from a positive point of only the ordering part towards the decision making by an individual, where you will be quoting all the opportunities or options available in front of their eyes, which will be visualized by the individual, and they will be trying to take a decision which is good, which is not good, what is needed for their immediate and what is the need for their future action. So the decision will be taken by the individual. So it's a soft shift from the professionals to the society or the individual one. It takes whole system approach, that is integrating the whole system, including the healthcare within all the age group. With the society, you are not having only one particular age group, maybe old age alone, we are not having. It starts from our childhood to old age. So where from that different age groups with the different health and social services, and what are all the services all available with all age groups. So it becomes a whole system approach. Then it provides all age approach. This is what I mixed up and told you. And it recognizes the contribution of communities and voluntary and community sector support. Earlier, recent past, we were talking about the public-private partnership. This is what which involves the volunteers, community members, or the any NGO sectors, and any other industries or any other, like there are lots of societal and the NGO groups are coming out with the helping mode. Now during this pandemic, if you could open your WhatsApp, you can come to know there are blood services available and the food services available. Food services not only for home people, or the people those who are home quarantine, and people those who are old age group, and people those who are in the platform dwellers, everywhere. There are some sectoral people, some community voluntary people are coming out and giving their contributions. Likewise, there are some, it makes this personalized care when you think of, it gives an opportunity for you to contribute, get the contributions from the other sectors towards the health care of your individual. So the next slide talks about what are the principles of personalized care. When we think of some of the concepts, with some basic concepts, we are moving and we are getting track with all the other aspects. We need to have some principles also with us. That says about patient choice. Here, the individual or a nurse or a clinician is not going to take any decision. The choice is given to the individual or a health consumer, healthcare consumer, and they are going to decide that one. And shared decision making, it is the individual decision. Again, we, the health professionals, along with the patient, family member, and if it is needed, the society also involved to take some massive decision or to take some individual decision on an individual or with the family members. So the decision or the choice which is preferred by the individual is going to be shared with the professionals and the needed party. So the patient activation and support of self-management, supported self-management. You can see that the self-management word. Earlier we were offering the care, now we are making the individual to self-actualize to manage their own care. That is what the another principle we need to think of. The social prescribing and community-based support. This is already I told you the community and private partnership, how you can include them in involvement of or planning or implementing the massive care, the personalized care and support planning. This is what the community-based support people, how they are going to come into the force. And the budgets, this is again a more important aspect. The budget is not only planned for the individual health care and the family members and society is planned here. So those points, these are all some of the principles we need to keep it in our mind while going for personalized care of an individual or family. But what is the benefit out of it? It improves the people's health and well-being, reduces the pressure on stretched healthcare services, and helps the healthcare system to be more efficient. And also it helps to make the decision about managing their own health so that they can live life they want to live. That independent living they can have it. Helps in supporting them to connect to the care and support options, which these are all some of the benefits. And what are all the components? This is what the similar like principles. So you have some, the National Health Services of Scotland, based on their issues and the care which is needed, needs which is collected by them. They were trying to do some brainstorming sessions and brought some of the concepts. And these are those concepts were made it as a components of 6 components they have prepared. And for this action plan also it was prepared. And shared decision making, care and support planning, giving a choice to them with the legal rights, and prescribing with the community-based support, and self-management, and the budgeting. All these 6 which we have discussed in the principles also. How come that personalized care services is going to become a powerful one? How you can make that if you think your client as a customer, and to make that customers satisfied and your service to be a powerful one. There are some tips which is given by the people. If we follow this one, sometimes definitely we may get in close with the individuals. And this is to get to know your customers by name for their person-centered care. It is again a person-centered and the individual concentrated care, where knowing the clients by or calling the clients by their names, where you can get some sense of closeness with the individuals. And that there are some research reports which says that major brain activation occurs when the participants hear their own name being called. The experience is more memorable and the customers feel more valued. This is especially important knowing that 68% of customers will stop shopping or doing business or taking care along with you. So in different way towards with you. And next one is to recognize and reward the loyal customers. This is again, we are not going to issue some of the awards or those things. Whenever the customer reaches you and spending some time with you, making them to sit and offering some maybe a coffee or talking to them, that may be a that definitely which will be considered by the our healthcare customers as a rewarded one. See, நான் அந்த நர்ஸ்ட போன உடனே அவங்க என்னோட பேரை வச்சு கூப்பிட்டாங்க, என்னை ரெகக்னைஸ் பண்ணிட்டாங்க, என்னோட ஃபேமிலி இஷ்யூஸ் எல்லாம் கேட்டாங்க, என் கூட உட்காந்து ஒரு காஃபி சாப்பிட்டாங்க. இந்த ஒரு விஷயம் அவங்க யோசிக்கும் போது it is more personalized or more close. The individuals are coming towards you, and whatever you suggest, whatever the options which you provide to them for their needs, definitely which will be taken up by the individual. And send handwritten notes by recognizing their values. If you are sometimes maybe you can feel that when you get a greeting cards from your friends, definitely you will be feeling more happy that my friend has recognized my body, or my friend has recognized any of my special days and he has given me a card. Like that, if you think that some of the words which is written, even when you reach the hospitals, you can see that the notice board sometimes will be filled with some special nurse's name. A few hospitals are following the same thing still. Some nurses name in the month, maybe a top nurse or a star nurse, like that they will be calling. So that type of rewards and the feedbacks, which is more important, they consider that as a more important one. They'll value your feedback also. And do business with your customers with a good coordination. Educate your customers with the free listing and classes and demonstration. This is again, it is not completely, don't think of it as an you are not an MBA student, MBA students to consider that as a customers. We think of some of the small teachings, minimal skills. Maybe a diabetic patient, if you get how to teach, you can teach them how to do a food care. Likewise, you can think of a small teachings and small skill sessions, maybe involving them in the WhatsApp group, talking to them, giving some videos and giving some skill videos or demo videos. Those things, health tips, those things will be more considered for them. Create a customer loyalty program. Sometimes we can even call them to our places in our groups and we can trade them also. These are all some of the tips which will help you to make your customer very close to you. And the key commitments and actions. And this is what it is planned for them. We also can adapt the same concept, I think, because they were saying that personalized care must benefit millions of people. This is what they're saying. When we think of our person-oriented or customer-oriented care, it should reach millions and lakhs of people. To reach that, we also supposed to get immediately trained people to a certain extent to reach the recent future. And then near future, and then you can think of lakhs and thousands of prescribing workers or the paramedical officers to reach them to their doorstep. Okay, the personal and everybody have to think of the personal health budget and the support plan, and we need to prepare lots and lots of thousands of professionals to reach them. And what is the intended outcome? What type of outcome we are expecting out of this one? That is, every individual have to understand their conditions and disability better, and they should feel more confident and able to manage their own health care, and they should understand the options which is available for them, and should recognize the triggering points of their early signs and symptoms or the chronic sicknesses, and they have to understand when to seek help and where the help can be opted, and they have to maintain some of the social connections to get the recent the advances in the field and the transition more smoothly between the services to the people. And wherever appropriate, we need to consider the use of personal and budget. These are all the expected outcome by offering the personalized care we are expecting. And to conclude this one, the healthcare practitioners are vital for enabling people to experience personalized care. And we are working on a number of programs to ensure our workforce has the confidence, skills, and knowledge to bring this to life in a supportive environment. Okay, to conclude that, this caption also again I like it. Nurses are there when the last breath is taken The nurses are there when the first breath is taken. Because even we can remember when we were the midwives in the labor room, and definitely the baby, once delivered, it is on our hands only. The first face seen by the baby is ours. And at the same time, when the death occurs in the ward, nurses are the person who is doing the last process of the death of process of an individual. So we are the most important at the backbone of our field. So that we cannot deny it. And that to this current pandemic situation, which demands your services more. At the same time, before concluding that, a few more sentences I would like to add here is, because Madam Dr. Rebecca is also there with us, and I place it as a record of request also to Madam. And there are some certain research reports recently we received says that the nurses are with a greater risk of mental disorders, mental illnesses like stress, depression, even the suicidal rate in the female nurses is comes about around 23%. A recent report says that this pandemic situation, because of the workload and the work pressure and the stress and their own health maintenance, family maintenance, and the continuous shifts duties. So it is needed for them to have a counseling sessions or to have a work pressure relief sessions are needed. I request Madam to arrange some of the counseling session for our AVMC nurses, even as we have a counselor with the campus. So at the same time, I would like to congratulate and wish all the students and the nurses, those who have participated in this program, they are very good and are very happy International Nurses Day, and wish you all a healthy and wealthy life in future. Thank you once again.
Thank you so much, ma'am, for your valuable opening informative speech. Next, I request our second speaker, Dr. R. Kanadwali, Principal of Celebration Nursing College, Mangalore. Before starting today, let's have a short glimpse about Madam. Madam has completed has UG College of Nursing, Madras Medical College, Chennai, PG at Vivekananda College of Nursing, and PhD at Unaha Mission College of Salem. Madam published and presented many research articles in national and international journals. Now, the wait is over. I request Dr. R. Kanadwali, Madam, to share her wisdom on personalization of care and compassion. I welcome you, ma'am.
Good morning to the organizing secretary, principal of college, and organizing persons, student, SNA president, SNA advisor, and who's going to give vote of thanks, and Dr. Rebecca Sampson, Director of Nursing, who had gave presidential address, and all the participants who are listening to the talk, the Nurses Day program. Good morning to all of you. Here, I must thank the organizer, first of all, the principal and the Vinayaga Missions College to give me an opportunity to participate in your program, to give a speech on the topic given is promotion of caring and compassion. A great thing that every nurse is enthusiastic and very glad to celebrate the Nurses Day always every year because our founder, we remember our founder who gave this modern nursing and who gave status and image to the nursing. So that only every year for her remembrance and for the encouragement of budding nurses, every nurse to inculcate our own behaviors in the nursing path. We celebrate Nurses Day. So as like that, 2021, we are celebrating, every college celebrates. But thing is, this 2 years, 2020 and 21, we celebrate Nurses Day in a pandemic situation. That is the problem with us, because we could not join together and celebrate. And even most of the nursing students and the parents especially afraid to approach the pandemic, and how to care the patient and how to care themselves is the challenge nowadays. But anyway, we all have joined together to celebrate, and as much whatever the possible on that topic, because only half an hour is given. So for that sake, I have prepared. But the topic is well chosen, as the principal of college was telling, where it has brought. It's a well chosen. And when we talk, go on with each slide, I will explain you one by one. Kindly listen, and this slides may be sharing with you later through your college. I welcome all of you to the session. Please carefully listen, because this is a great opportunity as given, I think, nearly apart from the guest, 83 participants have joined, you nurses. Please listen. Promotion of caring and compassion. I am working as a Zulekha Nursing College as a principal in Mangaluru. Thanks for your write-ups, which is given by the MC. As Madam the Director was telling Art of Nursing, I also brought this to give you a brief note about nursing, that we call nursing as a science. So what is the difference between these two? I thought, let me tell you first before we go on to care and compassion. So science of nursing, the science, because even in our degree we received Bachelor of Science in Nursing, like that only it is mentioned. So what is science? Science, it's a combination of all our knowledge, performance, skill, and attitude. This is the combination. When if all these three are there, we say that it is a science-oriented subject. Then the current models of nursing focuses on the rapid expansion of scientific discoveries being made in medicine and technology. Nowadays, you are really seeing in this pandemic, rapid expansion of scientific discoveries. Many discoveries is going on to fight against this pandemic, especially if you want to tell, many vaccines have brought the last 1 year. They made the challenge and they brought to the vaccine to our country in the late 2020. Anyway, it is in the access now. Even nowadays, 2-3 days back, 1 week before, there was one more drug, Toxic 2G was introduced, and even how to test this like coronavirus, COVID, everything. It is rapid expansion. Every time one disease comes, or even other than that, also many researches is going on to find out solutions for many of the nursing issues. Even I could say, for your own understanding, there are nursing research, you are doing it in your 3rd year level to find out solutions for the problems which you face in the bedside. So that also one more expansion of your knowledge, scientific knowledge we create. That's why modern nursing has developed. So it's going on. Its research is going on all the level to discover important alternative medicines and the newer technologies. It's all called as science of nursing that requires best of academic and clinical experience to be a competent nurse. Then comes to arts of nursing. This is about science. You keep it in this. So science requires best knowledge, skill, attitude to we also to bring out the rapid expansion of scientific discoveries. So always, why do you select this nursing? And also we are undergoing 4 year of degree, bachelorate, and 3 year of GNM program, and then 2 year of masters to get broader range of academic excellence. So apply to the clinical experience to give better care to the patient. Then this art of nursing. Then the art of nursing, it is in the contemporary health science added along with our science. Few pointers added to say as a art of nursing. That is only. So always our skill, proper skill, knowledge and attitude and advancement of technology is required. Along with that, what patient and other families are expecting is to be caring and compassionate, better communicative. That communicative is much necessary. So all the patients and the families are really expecting from the nurses, especially, that care should be in a compassionate way, and better communication is required, effective communication required. So what this is only will give you better patient-centered care. So one by one we'll see according to the organizing team. I have got to explain about caring and the compassion, and communication also I'll be sharing with. So these three included with our knowledge, skill, attitude towards the patient. So these are the three main aspects we should concentrate always when we give care. Actually, bad situation because you young nurses are there. So I want to tell you that what is the present scenario in a hospital. Though the nurse is having better skill, better knowledge, better attitude, but compassion, care. I don't think like nearly, maybe we may be providing 70%, not all the 100% care with compassion is there. I cannot say, though we are nurses, we must agree that what are the conflicts or what is real situation in the hospital is going on. Then only we can correct ourselves. That is always, even I do tell in my college with my students, our knowledge, skill is expected along with care and compassion only. Only knowledge and skill will not work out, because already I said this is art. Patients and families are expecting care and compassion. Please remember these children. Care and compassion is most important aspect expected in the modern nursing. To, as Madam was telling previously, the principal of college, personalized care, how it was self-management care and customer care. So all those things relate your care and compassion. Next, we come on to definition of care, caring and compassion. It's each one definition I have given for your understanding. First one is more definition of care. Moral ideal nursing is a provision of care necessary for the health, welfare and protection to satisfy the physical, psychological, spiritual, cultural, social and emotional needs of an individual or family. So it's a provision of a care necessary for the patient or the client to maintain good health and good welfare of and protection, especially protection from all the aspects. What do you read in the health definition? So the aspects of health, you may be knowing physical, psychological, spiritual, cultural, social and emotional needs. Added to that, occasional need also is added. So these are the needs moral ideal nurse should satisfy the individual and family, because occasion in case when the patient comes with some physical disability, you're taking care of their psychological state and also how to go back with their occasion. That is a major part. A nurse has to strengthen the client in that when they are in the hospital. So that is the care. A definition of care. Moral ideal nursing is a provision of care necessary for the health, welfare and protection of an individual and family. Caring. Next definition is caring. Caring involves values, a will and commitment to care a person. That is, you can do all those things which is mentioned as a compassionate way, loving care, kindness, warm, sensitive, sympathetic, responsive and considerate to others. This is called caring. So let us all check all these things. Are we applying when we give care to a patient? This is about caring. So each word is a self-explanatory. Even first year of GNM, BSc could understand and need not go word by word to explain. So caring involves will and commitment to care the patient with all those bifurcated like qualities of nurse, roughly we can say. Then the compassion, definition of compassion. Compassion literally means, it's as Madam Director of Nursing was telling, suffer with. So the same meaning, it literally means to suffer together. What it means, many researchers have defined this, that feelings that arises when you are confronted. That means when you face the patient, when you face any client. So what is the feeling they have? So that must be your feel, and you should be motivated to relieve that suffering. So like one patient comes with a fever. So what only you have fever, go and sit there. I will come and check you. It's not our answer. Oh, sir, are you suffering with fever? Okay, let me check. First, you provide comfortable position. That's only mandatory. First and foremost, our diagnosis, that implementation of care will come. So let me make you comfortable, sir. I'm so and so. I'll be coming and working with you to relieve your problem. This is the way compassionate talk we must have. So this is again, we'll have to get back. I'm not telling all the nurses are not practicing. 70% of nurses are practicing, let 30% have to be improved. Then only we can achieve 100% in our field. This is about definition of care, caring, and compassion. If any doubt is there, please kindly interrupt me in between. Then the key concepts of care. So one like researcher Rogers, it developed the 5 C's to describe the concept of care. So there are 5 C's: compassion, competence, confidence, conscience, commitment. Along with everywhere this knowledge, skill, and experience, practice will come. Students, please make a note of it. So the compassion, so loving, the compassion literally means, previously I said, it's suffer together, suffer with. So you understand their problem, what way the client has brought to you. The family members may be in tension, the client will be in the tension. I think students, you would have got the postings in the hospital that time when you make an admission to a patient. So you may be seen a situation that patients and many relatives will come. So what is happening? Please don't know, this is the suffering of the client I have brought. Kindly help, like that. The many quarrels will be there. So you will have to settle them down and compassionately, as I said previously, each and every word is very important to make the client to be comfort and calm and reduce their pressure, anxiety, what level they are undergoing. So understand there. That's why I used to say to all the students that whenever you see the patient in the clinic, don't see that they are a patient, some outsiders. They are your own family members. I think Tamil Nadu always we call the patient, when we see the patient, if a male person, Ayya, if a female, Amma, like that. So that word itself, it tells that you feel them as a father or mother, so that each one should feel, each nurse, when you face some client, feel them as your family relatives, maybe brother, sister, father, mother, like that. That compassion should be there. So you could practice well when you feel like that. Then competence. Competence here it says what level your academic performance, like what are the knowledge you have in a proper way, then the skill what you practice in the collegiate level, or that can be practiced in your service also. So competency, daily you should read to develop your competence. Not that I have completed my course, so that I have got 1 degree, I am ready to work. Daily I can go for 6 hours of duty or 8 hours of duty, then I will finish off my work, I come and lie down. It's not that. You improve your knowledge, daily read, up to date. Many journals are there, many newspapers have gives recent advancement, daily advancement of technology, what way we could improve. So this is competence, day-to-day life, every day 2 hours, please, all of us should spend in reading to develop our competency. Then confidence. Confidence is very important. Like a nurse, that's why when madam was telling, many of the nurses were under pressure, depression, and even we are seeing many papers, many of the doctors, nurses, because of this pandemic, They could not face the situation because always they were carrying the patient and they are seeing many deaths, this, that, complete crisis. No, they were in the 24 hours of duty. So they are even missing their life. They go ending their life. They're making the suicide and all because of this depression and pressure. But these things can be overcome with our own confidence. This is the confidence. How to increase our confidence? That I can tell you with some analysis that is called SWOT analysis. SWOT, each word letter, each S means strength, W weakness, O opportunity, T threat. So SWOT analysis. So each one of us understand, accept. Regularly we should do the SWOT analysis. What the SWOT means strength, as the word described, it is strength. What are my strengths I have in my profession and my personal? So these are the strengths. First list down all your strengths, which are available with you, which are within you, inculcated. Even some of the strengths will be within you, inborn nature. Some of the strengths inculcated from your teachers, from your role models, where you work, even the role model, not only your teachers, even the customers, the patients also may be the role model for you. So list down all your strengths. Then the weaknesses. What are the weaknesses which it's not allowing you to practice properly? So those weaknesses also you write. So weaknesses should be, we should overcome those weaknesses by adopting better strengths to overcome all the weaknesses. Then the opportunities, even the opportunities also can be utilized to overcome weaknesses. What are the opportunities is given? Whatever the opportunities will be given in your collegiate or in your hospital setting, please make use of those opportunities. Like what the committee is there, your SNA. So that SNA every year used to select the vice president and your secretary, treasurer, those kind of designations are there, executive people. Every year they select. So use those opportunities, compete for those opportunities. Because I think all the college will take up nomination for those kind of election, and students, other students will vote. They will be selected. So grab the opportunities and work on with those opportunities to overcome all your weaknesses and strength, build your strengths. Then the threats. So to make you having of all these things, what are the threats are there? Maybe your weakness may be one of the threats. Or apart from that, even the having of opportunity, whatever the opportunities comes, you should analyze with all the threats may be there in that opportunity. So when you do this proper SWOT analysis within you, you can reform your confidence in a well manner. This is the thing. Then the conscience. Anything you do, like for your own self-care and also the patient's personal care, client care, please use your conscience to work with it. Manasachi. That is, must be there everywhere. Then the commitment. Be committed to yourself, because you had come to take up the nursing course, maybe with your parents' influence, or somebody, maybe your cousin or somebody maybe studied, so that the parents would have told you go there to study nursing and you may be having better opportunity in abroad, so that you would have come without your complete concurrence. Even though, apart from that, this is a parent wish, you had come, so being obedient to parent, you have taken up the course. But after coming here, if you don't study, parent may pay the fee regularly, but if you don't study, make use of opportunities, automatically you are the loser. So whatever you have taken, please be committed to yourself. This is for your education. When you practice as a nurse, you be committed to your patients and also to your hospital setting. That is very important. Wherever you are working now as a student, you will be working in your parent hospital. So that time, be committed to your ward, whichever ward you are given with. Be committed to your ward in charge. The secretary will be there. The ward nurses, supervisors, nursing matron, everybody will come. So be committed to them. That's why you are committed to your management. So when you properly practice all these 5 C's to give a care to the patient, automatically, definitely, I can say that care will be very effective care. These are the key concepts. Then components of caring. So what are the components? Those previously we had seen, which are the ideas. This is components with the different bifurcated parts of the caring. What are the parts? Different parts you can see. Patient-centered care. Always, the modern nursing says that it is a patient-centered care, not that like hospital-centered or not that something unit-centered care. We are not providing individual patient-centered care. What the patient is expecting, how we can promote the patient in a proper manner. That's why this is patient-centered care and compassionate. Everywhere where there should be a compassion in your care, and it should be effective communication. As I said, care, compassion, and effective communication is the major phenomena to provide, or as per your topic says, promotion of caring and compassion. Compassionate care can be done by only these 3 aspects. So effective communication is more important. There, now, after all my years of practice, I could say that the communication is lacking with us. Because of that, we could not practice independent nursing. I can tell you that, because whenever we are in the ward, we read here in the college nursing diagnosis, you frame the nursing diagnosis, you plan the care, you implement the care, everything you are going as an independent nurse. But when you go to hospital, really I can tell you, if all of you are practicing, definitely not. Why it is so? Because we are not communicating effectively, we could not practice that independent nursing. So we go there and we say all the work, we do all the work as per the list is given. And as Madam was telling, director of nursing, documentation, and these all the other things we are doing, readily we are doing, but we are not in a proper way of patient-centered care, because we are not giving effective communication. So this effective communication is much important to practice properly the independent nursing. That is why it's not that if you are practicing independent nursing, you are not including in the team. You should work as a team, but at the same time, the nursing should be practiced properly. The team management is much important. What are the other team comes with you? Like physician will come, you nurse will be there, physiotherapist, pharmacist, and other kind of lab technician. Everybody you will have to communicate always in a day your shift. So the proper communication will give you, like sometimes some of the drugs may be allergic to the patient. That time patient may express with you because you are there 24/7. They may forgot to express to the physician. So when your patient is expressed with you, madam, that drug is allergy for me, rightly you should say to the physician when he comes for the rounds. If you forget that, or if you're not communicating, or if you're like hiding things because of your like verbal communication may not be proper, thinking that if you do not share that, the sufferer is like patient only. So that only it means effective communication is required. Then support, and you be advocacy. Support, you support the systems, whichever the system comes to you, like as I said, team members. So you support, and you be support to the unit, total unit. Then informed participation and meeting patient's basic need. So informed participation is again with the patient and also with the relative and with your team members. Clear-cut participation is required. No, somebody can come and meet me, I will not go and meet. It's not the proper thing. When you do that way, automatically we cannot meet that complete patient-centered care. So participation of your each and every step of patient care is required in meeting all the basic needs. These are the components of caring. Then qualities of caring a person, 10 curative factors are there. So with that, we'll go one by one. There are 10 factors available to say qualities of caring person. First one is embrace. Embrace. You embrace. Practice loving kindness with self and others. First, you embrace yourself. Yes, I am a good nurse. I'll be doing like that. So, and others also, if we are doing it, we can do it like that, because this pandemic expects that so much. Because one person, everyone, many of the nurses having family, they leave the children, they leave the family, come back, do 1 week of duty, 1 week of quarantine, and whatever the limited resources are available, they need to adopt that, and they'll have to go on first. So when we are in that kind of situation, you embrace yourself and also the others who have having a proper kind words. Then inspire. Inspiration is much important. Every activity, especially this is very much needed in our nursing profession. You be faithful and have your own faith, hope, and honor others. So maybe 1 or 3 colleagues may join together and work. Faith on each one. You develop faith on each of them and hope with them. And if one of the, because I think when I was in a student period, when I studied BSc, we used to go in a group only, 2 members, 3 members used to be given a ward to help the patient. So that time we ourselves will inspire one by one. So when my friend is doing some work, I also join with her. If I could not do something, she'll come and help. And if she could not do anything, I used to go and help. So we developed good kind of hope on our nursing practice. Through that way only I can tell very well. So when your friend is doing better care, you just honor them. Then the patient also, you should do that. The patient is very important. Every word of this, whatever the activity, you help the patient, you gain first of all faith among the patient and the hope. You provide hope for the patient. Then the trust. Trust is much important to you make your patient to be trustful to you, and you must trust others also to nurture your personal growth and the patient growth. Then nurturing. You help trust and caring the relationship. That is very much important. Then forgive. Forgive is simple meaning is just you forgive something. It's also included, but at the same time, when somebody do a mistake or something else, even the patient, when the patient is expecting something, you listen properly. And whenever the patient, like you can say very well here, like when diabetic patient may ask or for the sweets in the hospital, or the hypertension patient may ask more of salt, otherwise they'll not eat the diet. So listen to them. They may say that, yes, I will not eat it. That time you will get lot of scolding also. So you listen to them properly and accept positive and negative feelings, encourage them to do properly. That is only forgive. Listening is much more important quality to a nurse. Then deepen. Problem solving methods for decision making. So kindly, we all should understand problem solving methods for decision making. Simply, we should not do all the orders which is given, but which are the orders are given, just try to analyze that. So then you take the decisions that will be better patient-centered care. Then the balance. Balance is teaching and learning skills. Whatever you have learned, and try to adopt those learning skills which is there, and which are the which is you are practicing here, or you had seen the patients in the hospital, that you go and refer in your books. What are the symptoms or the signs the patient is demonstrating, like that. So the balance between teaching and learning skills is much required. You to learn proper care to the patient, care, and also at the same time you should serve the patient in a better way. Go create is another factor, that healing environment that respects human dignity. So the patient has come nowadays. The pandemic, we could see, the patient beds are not there. Those the patients are on on roads, and even the hospital wards outside, trees and under the trees like that and all. So how the healing can occur. So the patient and the patient relative may go with frustration. So respect the human dignity. That is very much important. So we must have all those kind of proper, comfortable, we must provide to the patient comfortable environment. Then ministering means you should check on the patient always there, physical, emotional, emotional includes your psychological, spiritual, human needs. So when the patient is with you, not only giving injection, giving tablet, it's not that emotional needs should be taken care by talking to them. Spiritual needs as per their religion, you can tell them, please sir, whichever your religion from, whichever God you like, please pray, and I'll help you to give you a comfortable place for your prayer. Like that, you should take care of all those health needs of the person. Then open the mysteries and allow miracles to enter. Some kind of things will be there, like whatever somebody will come in the later stage of any disease, or some with they will not be in a position sometime. The patient may not be in a position to recover themselves. The family members will not accept also. At that time, they may expect, yes, I want some miracle to be happen. So you can be open enough to say properly, effectively, you should communicate with them what other things can happen out of their disease, how they can get recover of that those problems. So give them some assurance on that. So these are the 10 curative factors a nurse should apply when caring the patient. And also I feel after reading this 10 curative factor, the nursing students can apply in your own self during your studies. So that will give you much more booster to overcome all the issues when you face from your first year to fourth year. This will make you to adopt, accept your nursing studies, and whatever the situation comes, you can be a effective nurse and competent nurse in the society. Next, now we have completed the care. Now definition of compassionate care. Compassion, definition of compassion, and already I told you, this is definition of compassionate care. Care provided to a family member or other visitor to feel comfort and support. That is much important. So this is the care. Compassionate care means it is provided to a family member or other visitors or other family relatives to feel comfort and support. Another definition, it's one type of medical and emotional care for patients with terminally ill diseases, and may include hospice care also. This is all here also. It is especially hospice care really needed this compassion in a better manner. Then assistant to a resident whose well-being is suffering or at risk or who is dying. So this is called compassionate care. Importance of compassion in healthcare. So why the compassion is required? That is, already we are caring, we do go give medication, do give all comfortable bed, all those things, whatever it's there. But the compassion, why nowadays the word come as a compassion, it's much important. Offering reassurance. Nowadays, because of the critical threat, in not only the pandemic, every situation the individual we face is a very critical threat. That I can tell you that because of this social media, which is available in our hand as in the name of mobile. So that makes people to go go in a, they are not in a group. So each individual is separate and separating themselves from the world. Because of that, many of the youngsters really they develop frustration. They are not motivated in a proper way. Sometimes, if anything, they are getting failures, automatically they go on depression. Recovery is not so simple. So that it says first one is offering reassurance. So the patient will come in that level. We could say that. So we can see the patient may not be in a proper confident. I could recover myself with the care of the patient, nurses, doctors. The patient will not come in that level. Last moment, no, I'm going to die. Anybody nowadays you could see the person will think that yes, I'm going to die. So answer very well come, or somebody with a lot of frustration, they will tell, what I'm going to do hereafter, let me go, let me die, like that. So these are the words we get nowadays, depressed voices of many people. So that this compassion plays a much role in the healthcare. So offer reassurance when you meet the patient. Sir, you may be all right. Please wait. You are got admitted. You had come to our good place. So you will be healed with our better care. You will be given with better medications. So offer that reassurance of their life. That is much important. And listening actively, calm the patients. So when you listen properly, the patient, when they come to you, to the hospital, they'll explain all those things. Sister, I was suffering for the 1 week, for a month, I was troubling this, that, any problems they will tell. So listen carefully, and that makes the patient be calm. Otherwise, no, sir, you lie down. I want to do something. I want to check your vital signs. The doctor will come. I should report. Like that, if your own duties cannot, the patient will not be calm. The patient will not be happy of your environment. So listen them properly, actively. Then that lowers their blood pressure. If you make the patient calm in your unit, because that is the newer place to the patient. The hospital is a new place to them. So you should calm the patient when you receive itself. Listen to them. That lowers the blood pressure. That may, why it's mentioned, lowers the blood pressure. That reduces their frustration. That is the major thing. They reduces the anxiety. So then they could receive the whatever the treatment you are providing in a proper manner. That enables faster recuperation. That is faster recovery. Then it reduces the pain. Even the patient, when they come with the pain or something else and all, when the compassionate nurse works with them, automatically after third day, fifth day, patient will tell, sister, I'm having a little reduced pain, sister. No need of taking painkiller tablet. Thank you. Like that, they used to say. So the nurse should be compassionate to bring to that level. Then that makes shorter hospital stay. Always anything we used to say in the management, we study who can make the duration of the patient's hospital stay reduce. Who can reduce the patient's hospital stay? Only that the nurse can reduce the days of patients who stays in the hospital. Why? So all these things, if you apply, then automatically the patient stay in the hospital will be reduced. The patient will thank you and go. So this is called importance of compassion in healthcare and principles of quality compassionate care. What are the principles you can apply to provide quality compassionate care? Giving patients a positive experience. So patient may come with some other disease. So maybe you can say that some patients will come with maybe posted for mastectomy, you can take. So the patient may be afraid. So what to do? If my breast cancer, I lose my breast, what will happen? Like that, and all patient may think the problems will be there. They will be undergo with the. They will be undergoing the depression, lot of frustrations. Even the spouse will have the problem. So positive experience. Call the other patient who had undergone the surgery already. Call them and give them an interview. So that also one kind of experience. You can give them positive experience. So like this lady had underwent the surgery. Now she is okay. She is able to do all the work. She has joined for the duty or like that and all. You should give them previous positive experience with the other patients who had undergone the same problem. Then having a highly skilled workforce. So that is much important in any of the hospital. Having a highly skilled workforce, automatically you nurses and nursing students are working in your hospital. That only we can say that highly skilled. It means those of all what we've read in your the definitions: knowledge, skill, attitude, then your compassion. Those things are required in the art of nursing. We learn. So that means highly skilled workforce. Then respecting privacy and dignity. patient's privacy but definitely should be granted for them in all the time, and dignity also. Oh, you go and lie down, I'll come. It's not that. Dignified talk should be there with the nurses. Then using clinical audit to evaluate the quality of patient care. This is much important. In all the hospitals, clinical audit is much important. Once the patient is getting admitted, we are carrying throughout the time till the 7 days or 5 days if the patient are there. Then afterwards, when they go out, we should evaluate the patient, getting the form of feedback or something else. So that make us again improve our quality in the hospital setting. Then working in partnership across the health, social and voluntary community. So always partnership is required to work with all the team. Then the same, still more are there, reducing health inequalities. I don't think much inequalities are there. Everyone is able to get this help, starting from low socioeconomic to a first class of every individual is receiving health in a proper manner. In spite of that, we should reduce somewhere. If it happens also, it should be reduced. Then putting patient safety first. It's very important. When we are trying to experiment something, whether the patient is going to affected or not, if in that case, if the patient safety, if patient has any problem, we should not adopt those kind of like care aspects. That is much important. Then meeting the individual needs of patient. As I said already, whatever the health needs are there. So when the patient stayed in the hospital, complete stay period, we should meet all the health needs of the patient in a proper manner. This is in the nurse's hand only, nowhere else. Nobody can do that. Please make a note. Then developing effective leadership. So the leadership quality, each one of you should experiment, be of expertise. And start from nursing students, nurse in charge, then the secretary of the particular nurse, then supervisor, NS, ENS, everybody has a role to play this leadership. Because nursing student, when you are a leader to the patient, what way you will be? So you be advocate to the patient properly, you communicate about their problems, about what they expect. So everything, what are the care you can provide as a nursing student, everything you should plan and do that. So you are a leader over there. You need not expect, because already you had completed your education, academics from your college and came for practice. So being a leader, you try to demonstrate in between. If you have any problem, anything after you plan, you go and ask with your senior nurses and get it clarified, do the remodify your plan and do accordingly. So effective leadership plan is much important. So these are the principles of quality compassionate care. Then ways of showing compassion. There are some ways you can show compassion. So you can read all those things to show your compassion to provide compassionate care. So start with yourself. So start with yourself means, as I said already, you first clear of yourself. Just encourage yourself. That is very important. Without you encourage, you cannot have you cannot go and work in your hospital. Start with yourself. You encourage yourself to work in a proper setting and in a proper ward, because always these few issues will be there with the students. Madam, I'll not go to that ward. Madam, I don't like madam. Madam, this please change, madam. Like that, some of the requests may come. So this is the major part. Start with yourself. You first correct yourself and make energetic, encourage. Yes, I'll go there. I'll read whatever the patients are there. I'll just take a note and I read myself, and also I help the patient. Like that, you should have a better positive feel and go and work for them. So the same manners, you should help the patients to develop. So the patient has come with the disease. You tell the patient, sir, like this, you had come with the disease. It will be cleared. You will be cured. There are measures are there. Healing measures are there. Many like advancement is there in your treatment. So better you will be healed, sir. You will be going and you can take up your the rest of the activities soon. Like that, you should encourage the patient. Then communicate verbally and non-verbally if touch is required. A touch, if appropriate, if required, you should do. So communication is much more important. Then encourage others. Encourage your team members and your own fellow colleagues. That is much important. And even encourage the patient relatives. The patient will come with one disease. But after you speak with them, sir, you will be healed, you will be cured. Like that, the patient may be encouraged. And patient will feel that, yes, I will be getting cured. But the others, family members, what they think? No, the person is suffering because of the illness. Person may undergo some of the other physical changes. By seeing that, the family members also may lose hope. So encourage others in all the levels. Then express yourself. What you are going to do. What is your duty? What you have got. Your all kind of capabilities. Express yourself. It's not that so in deep manner you're going to tell. By your gestures, you can show that you are a very competent nurse. That is much important. Then only the patient will get confidence to get care from you. That is much important. That's why always when we see the first year nursing students, we used to give them a talk. We should motivate ourselves. So that's why the uniform is given, and the white uniform, when you wear itself, you feel that, yes, I'm somebody. Like that. So express yourself in a proper manner to the patient, as that patient is encouraged to take care from you. Then show kindness. You should show your kind words to the patient. Then respect privacy. That is much important. Already I told you, respect each individual privacy is much important. The patient will come with so many problems. So whatever they express to you, maintain that, don't reveal with others. So that norm only we are taking in our vote. Steps to provide compassionate care. So this steps we can, adopting the steps, we can provide good care to the patient. Practice good manners. Then show personal interest. Take time to think about their problems. Always acknowledge their feelings. Last, take time to care for your own emotional needs. So practice good manners with the patient. That means properly we should talk, that effective communication. And one day because of your personal problems, you may be aloof or you may be disturbed, you may be dull, and that should not show to the patient. That's why it's called good practice, good manners, good attitude should be there. Then show your personal interest towards the patient care. That is much important. When teachers are coming, I'll practice, otherwise let me sit and take rest. It's not that. Show your own personal interest to take care of the patient. Then take time to think about their problems. So the way the patient, maybe you will be in the duty or night duty, so that time patient may call in between. Sister, come, I'm having this problem, that problem, they may express. So you should not scold them. But you should think why the person is having many problems. Frequently he is calling, I am going to attend. Why is it so? Think and act accordingly to solve the problem. Then always acknowledge their feelings. Acknowledge if the patient is telling one problem. No, that will not be there, sir. You don't tell like that. No, yes, sir. You have that. Like that, you speak to them and acknowledge that, yes, somebody is noticing my problem. That itself one recovery. One point the patient will have is somebody is there to acknowledge my issues, my problems. So that is much more important. Then all these things, when we were talking compassionate care towards the patient, towards the family relatives, but where is the time for me, you may think. But you should have your own time to take your own emotional needs. Think of that. That's why I said the confidence plays over here. When you do SWAT properly, automatically your emotional needs will be maintained when you take care of the patient. Next. Steps to create a culture to compassion in healthcare workforce. This is much important. What we can do to have a good culture in our workplace, that is much important. So define what compassion means. So complete workforce, workplaces, your team is involved, total team. As I said already, physician, nurse, a physiotherapist, pharmacist, and lab technicians, even the our own like housekeeping department, dietary department, all those are involved in our workplace, the health in our hospital. So everybody should know what is compassion. So every team should understand that, so that it will be inculcated to every department and everybody will practice. Then recognize the effects when compassion is missing. Which department or where it is, which individual is not doing proper work, they may do automatically like monotonous work. So there the compassion may get missed. So the leader should recognize that. Then consider the power of teamwork. So always teamwork is mandatory in every area, maybe not only in the hospital, in the class where you study, in the college where you study, everywhere the teamwork is important. Usually a teacher used to tell that batch is very good. Whatever I'm telling, they are practicing, they are doing well. They are academic performance is good manner. Good. Like that, if the teacher is telling means your teamwork is good there. All the students work together to study well. That is the thing. So here also, hospital also, we can understand the power of teamwork. Then scan the data for red flags. Red flags means which is alert, which gives dangerous signal. So what are the dangerous problems or some of the mishappenings where it happens? So those things we should identify frequently. Don't just change the culture, change the operation. Easily, one by one, if somebody comes immediately, in rotation, nurse will come to each ward, or in rotation, your teachers will be rotated to the each classes. So sometimes the practice of some students or the group may be different. So thinking that, so this behavior or this attitude is not proper, so I'll change something. It's not that. So proper operation, proper kind of procedure should be adopted to maintain the proper care. That should be. Then get everyone on board. It's very important. Everyone should learn what is our mission and vision of the particular industry or a particular hospital or particular college. So that should be known by everyone. Then automatically the workplace will be on the same manner of practice. Then recruit people who fit into the mission. So whatever the always hospital or the college has some kind of qualification eligibility to recruit. So those things should be adopted always to appoint the particular person to run the to carry out the work. So that is very important. Then when in doubt, like all the when I said the workplace has many teams. So each team member may have some of the issues on particular procedure which is taken. So when you have some doubt on that particular procedure, no, madam, this will not work out, will work out. So if out of 10 people, 8% have accepted, if only one of you have doubt, means one or two you have doubt, means don't be on so much like criticizing that matter, be supportive to that matter. Then that mission will go on. So these are the steps to create a proper compassion in healthcare at the workplace. That is more important. So how we can create. Then finally, effect of compassionate care in healthcare system. So as madam was telling, principle 2030, what we are going to have. So when I feel, when we promote proper caring aspects and the compassion, automatically 2030 we can achieve improved healthcare in a quality manner, and services also will be improved. So these are the major factors we should adopt for caring patient in our society. That is much more important. The present situation also expects that caring in a compassionate way. So if we care a patient or a client in a compassionate way, total community and the family and the individuals will get proper care, and they will be in a like proper good citizens of the society, and we will not face this kind of pandemic hereafter. Rest, all of us should pray that this pandemic should not be there in our society, and we should be calm and to practice our own problem in a proper manner. Finally, this is quality care in the healthcare. So when we adopt all those things, automatically quality care we can achieve in our health industry. That is always to know all these things, technological innovations and safety, integration of medicine and healthcare, improvement of work environment, improve clinician and patient interactions, smart healthcare data management, provide operational efficiency and effectiveness, provide equitable care. So already you all know that it is a quality aspects of quality care that only I brought here to conclude this. I brought over here. So when you demonstrate, when you practice care, proper caring and compassionate care, we can achieve quality health care in all these areas. Thank you for patiently listening my words, all of you, student, principal, and director of nursing, faculty, students of Vinayaga Missions College of Nursing. Thank you all. If you have any doubt, you can ask me. Thank you.
Thank you, ma'am. Thank you. Thank you, ma'am. Thank you for your valuable informative speech. Before inviting our speaker, we are glad to introduce you, sir. Sir has completed his MSc and PhD at NRS postdoctorate fellowship, Prima Fellowship. Sir has completed many research projects and published research articles, concept articles in national and international journals. Now I request Dr. T. Silvan, Principal and Dean, Professor, Institute of Medical Surgical Nursing. We welcome you, sir. College of Nursing, Dhoni BK, Maharashtra, to share his thoughts about technology-enabled care with us.
Hello. Hello, are you able to hear me? Kindly disable the screen sharing. Host disabled participant screen sharing. Kindly disable it, then I can start the screen.
Yes, sir.
Yes. Yeah, now my screen is visible to everyone.
It is visible.
Yes, sir.
Okay, me, I am audible now.
Yes, sir.
Yes, sir.
Okay, okay. Then I can start my presentation. Okay, okay. Okay. Okay, Miss. Firstly, Miss, I'm thankful to Dr. Muttamil Selvi, the principal of Vinayak Missions College of Nursing, and Dr. Samundishwari, my valued friend and colleague, and professor of Vinayak Mission College of Nursing, and all the organizing committee members for giving me the opportunity to present the topic on technology-enabled care. Yeah, firstly, my season's greetings and best wishes from Pravara Institute of Medical Sciences College of Nursing, where I am working as a professor and principal of College of Nursing, which is located near to the Shirdi in Maharashtra. My presentation will be based on the few aspects. First one is the concept, what is meant by technology-enabled care, what are the different perspectives we have to follow, the conceptual model which is used for providing technology care and commonly used technologies, and the role of nurses. These are the important aspects I am going to discuss within 20 to 25 minutes. Concept means technology, because everybody using or everybody knows the technology, what it means. Technology is nothing but the tool or the device or the application which is used for doing the things is called as technology. And again, healthcare industry or healthcare delivery system also is not exception. The technology is the ingredient, is an integral part of healthcare delivery system. And again, healthcare consists of technology as well as the human interaction. Both will be there, then only you can able to provide the effective and quality patient care to the patients as well as to the family members. And earlier days, the nurses are the healthcare providers. Most of them are mainly relied on the sense, on the physical examination and history collection. And that was taken over by the technology, where you have a advanced technology. The technology will make the healthcare professional to understand the healthcare professional about the disease and their conditions and their status. That's why the technology is playing very major role in the healthcare industries. You see the one you can see here the very simple example, use of pulse oximetry. Because earlier days we used to understand, if you want to know the saturation, oxygen saturation of the person, we have to assess the skin color, capillary refill, or we have to go for the ABG analysis, blood sample collection. Then only you can able to identify what is the level of blood saturation, means oxygen saturation in the venous blood. That with the help of technology, nowadays you can use the pulse oximetry. Means most of the patients, most of the individual you are using nowadays with the COVID pandemic, everybody is using in their home. That's why the use of pulse oximetry will help the healthcare professional to identify what is the level of saturation in their blood. Thus why you can able to make a proper diagnosis and you can start the treatment in time. That is the advantage, or that is the use of technology in healthcare delivery system. This is the perspectives of healthcare, means technology used in the nursing profession. There are 5 important perspectives. First one is the specific tools. Technology is considered as a specific tool. Means you have a number of equipments, gadgets, devices. That all is called as a tool. We have a syringe, drugs, diagnostic drugs. All other things are considered as a specific tool. The second perspective, we have methods for collecting and processing information. That is commonly we call it as a health informatics, telemedicine, teleconferencing, telecommunication, nursing informatics, medical informatics. These all will come under the collection and processing of information. That is the second perspective. The third one is the method for creating knowledge. That's why we go for a clinical trial. Yeah, we go for the clinical trial, randomized control trial, experimental studies. We do systematic reviews, meta-analysis. These are the technologies of the device which we use to create a knowledge. We use to create a body of scientific knowledge. That is the third important perspective of technology care. Then fourth one is the assembly of machineries. In the hospitals or in the clinics, you might have seen number of equipment, number of machines like X-ray machines, CT scan machine, radiotherapy machines, MRI machines, syringe pumps, then diginfusers. These are the number of machines which will be used for delivering the quality patient care. That is the first aspect, is the assembly of machineries. The next we have an assemblance of machinery and expertise. That's why you have a cardiac catheterization laboratories, you have a dialysis unit. These all, there will be a machineries. That machineries will be used for providing effective patient care. That is called as assembly of machinery and expertise. The common example you have now, the CABG surgeries, coronary artery bypass cath surgeries, because nowadays many of the patients will go for cardiac catheterization or the coronary angiogram. They will identify where is the blockages and how much is the percentage of blockages. If it is required, they go for CABG. Otherwise, you can able to go for angioplasty or you can go for the stenting. That's why the assembly of machinery we are using with the expertise, the medical professional expertise will be utilized. These are the different 5 important perspectives of technology-based care. The technology we have medications, drugs, other things. We use the technology for the informatives, or we use the technology for creating a new body of knowledge, or we use the technology for assisting the patient care, or we use the technology for providing the quality patient care. This is the different perspectives of technology-based care in the nursing services. This is the model, the conceptual model for the technology and nursing. Because the technology, nursing process, the delivery of nursing care, outcomes and feedback, these everything will all are interrelated. That's why firstly you have to go for identification and procurement of technology. You have to identify what is the technology, what is the device, what is the machineries you require for your patient care. That's why you have to identify identification and procurement of technology. Then you have to go for the use of technology for your nursing care delivery system. You have to utilize your technology for the nursing care delivery or patient care. And then when you are using the technology, importantly you have to follow the process of nursing process. Thereby you can able to provide the quality patient care. Then once you provide the quality patient care with the help of technologies, you have to identify what is the outcome. What is the outcome it has given with the help of technology. That you will identify with the help of that effectiveness and efficacy of the instruments, by reducing the mortality, by improving the patient outcome, by improving the prognosis of the patient. That all will help you to understand the effectiveness of technology and the satisfaction. For having the machine satisfaction as well as the patient satisfaction, that all will come as an outcome. And this patient outcome implementation of nursing care with the help of technology, that all will be depends on these mediating factors. That is very, very important aspect. The mediating factor is that the organizational factors, means whether the organization or the institute or the hospital is having the proper policies, procedures, guidelines, standard operating procedures, and they are very much interested to purchase the new machines and machineries. Then what are the technological factors, whether it is efficient, effective, and the satisfaction, the mechanism of action. These are the factors we have to consider when you are using the technology in the nursing care delivery system. Once you use this, then you will get the outcome. Once you get the outcome, you know what is the feedback. Then you can go for the purchasing and again procurement of technology in other ways. This is the model we have to follow when you are using the technology in the nursing professions. These are the important factors we have to consider, because you may have a number of technological equipment, machines, gadgets, but important thing you have to identify whether you have a capacity building, whether all the healthcare professionals, including the nurses, whether they have a training, whether they have a knowledge, they have a skill in utilizing the technology. Then it should have a affordability. It should be appropriate. The patient safety measure is very, very important. Then acceptability to the patients as well as acceptability to the healthcare providers. That all we have to consider. That is the important factor we have to keep in mind when you are using the technology-based nursing care. This is the number of areas where you use the technology: patient administration system, laboratory information system, electronic medical record, electronic health record, then management information system. These are the broad areas you use the technology for the effective implementation of nursing care as well as the medical care. These are the patient care technologies. The nursing, what we are using the patient care technology. We are using the patient care technology, direct nursing care delivery technology, indirect nursing care delivery technology, patient protective devices, patient assessment, monitoring and surveillance, patient assistive devices, nurse protective devices, and the communication with the people with distant by place and time, remote patient monitoring, continuous learning. Yeah, this is the first one, direct nursing care delivery technology. I will not go into detail. These are the some of the examples, some of the devices which was mentioned here. You can able to understand these are the devices or the tools or the technology you are using for providing direct nursing care service. Second one is the indirect nursing care delivery technology. Here it comes the artificial intelligence and robotics, then electronic inventory system, and then computerized staffing system. These all will be helpful for the indirect nursing care delivery technology. Then you have a patient protective devices. These again we have given floor mats, beds, alarm, mattress, lightning, then handrails. These all will be coming as a patient protective devices. Then you have a patient assessment, monitoring, and surveillance. That you can see the ventilators, stethoscope, thermometer, sphygmomanometer, otoscope, pulse oximetry, ophthalmoscope, monitors. These all will help you to assess the patient, monitor the patient, and you can able to get the surveillance of the patients. Then again, you have a patient assistive devices technology. You have walkers, cans. Then nowadays you have a robotics, which will helpful for the patient transportation, sitting a patient, making the patient comfort, wheelchair, bedpans, orthotics. These are the some of the devices or the technology which is used for patient assistance. Then you have a nurse protective devices. Means when you see this current pandemic scenario, you will be using this PPE, face mask, gown, gloves, hand sanitizers. These are the some of the things which will help you to provide the nurse protective devices. Then the communication with the people distant by place and time. You have the, in that case, you are going for electronic medical record, telecommunication, teleconferencing. You are using the mobile applications, call system. These all will be helpful for the healthcare providers to reach the people, those who are in a distant place. Then again, remote patient monitoring with the help of telemedicine and telehealth communication. You can able to monitor the patient's health status and the reports. These are the some of the healthcare technology what we are using in the nursing care delivery system. Commonly, what we are using, that only I have projected around 5 to 6 important technological advancement what we are using that we have projected here. The first one is the electronic sign out. This we have an handing over and taking over. Currently, most of the Western countries and the foreign countries, they are using the electronic handing over and taking over. You will be knowing that the handing over, taking over is nothing but it is the process of passing the patient information from one caregiver to another caregiver or one healthcare team to another healthcare team. Thereby, you can able to provide the patient care in the continuity as well as the safe care you can able to provide. And this electronic sign out, the handing over and taking over is the major precautions which will help you to prevent the major sentinel events, that is a major unwanted, untoward events or untoward problems that can be prevented when you go for the proper handing over and taking over. And these can be done with the help of the electronic sign out applications tools. There is a specific application tool which will be used in the healthcare delivery system or in the daily routine care practice. Thereby, you can able to do the sign out and sign in with the help of the electronic applications. The research studies have shown that when you are using the electronic tool, it improves the process of handing over, it reduces the omission of critical care patient information, and it saves the handing over and taking over time. The studies also prove that the electronic devices are helpful in handing over and taking over process. The second important technology what we are using in our patient care is the barcode medication administration. This is also commonly used in the developed countries, but in our India, we are using this barcode medication system in corporate hospitals like Apollo Hospital, Hindu Hospital, Okada Hospital. There we are using this barcode medication administration. Here it is also the electronic system which integrates electronic medication administration record with the barcode technology. Means each and every products, whether it is a consumable products or the medical products, every product will be having the barcode. You might have seen everywhere. The barcode will be integrated with the electronic medication administration system. Thereby, you can able to prevent the medication errors. That's why you can able to make sure that the right patient is getting the right drug, right dose at the right time. That's why the softwares are available which produces the alert when you are having the sound alike or look alike drugs, and it will provide the clinical advisory and it will help in proper documentation. That's why the barcode medication administration systems are done with the help of the technological software. And again, the study have proved that this barcode medication administration, when it is integrated with the electronic drug administration record, it will reduce the medication administration error from 50% to 80%. That's why you can see here the images. The nurse is scanning the barcode of the particular medication. Again, you can see on the left side, the nurse is scanning the barcode of the normal saline package. That's why it will ensure that the normal saline is administered to the particular patient. That's why the barcode medication administration plays very major role in this technology in the nursing services. Then you have a smart pumps. You might have seen the syringe pump or you might have seen the diginfusors. But nowadays you have a syringe pump with the medication error prevention software. The technology is there in that IV infusion pumps. Thereby you will give the alerts to the healthcare provider that the infusion setting is, if you are setting outside the pre-configured safety limits. That's why these smart IV infusion pumps minimizes the reduces the programming errors as well as to prevent the medication errors. That's why the smart pumps also plays very important role in the critical care unit, mainly in the critical care units. Then again, you have an automated medication dispensing technology. Means nowadays it is not required to go to the pharmacies or it is not required to go to the dispensaries to get the medication. That's why the clinical nurse who are working in the critical care areas or in the hospital or in the clinical units, when she contacts with the help of the automated dispensing cabinet, she can able to contact the people with them. They can able to get the medication at your doorsteps. That's why the electronic drug cabinet that stores medication with controlled dispensing and tracking of medication distribution. You can able to control the dispensation as well as you can track who has taken that medication, what time it has dispensed, that everything you can able to get it. That's why the use of software and digital technologies which enables medication dispensing process. And this will helps to minimize the medication error, minimize the workload of the pharmacies, and you can able to keep the better track of medication where it is dispensed, and you can able to do the proper patient billing. And that's why you can see here the image shows that the automated medication dispensing agents. By using this automated dispensing medication system, you can able to reduce 28% of rate of medication error, most importantly in the critical care areas, critical care units. The next important technology what you are using is the patient electronic portals. The patient electronic portal, that is also very, very important. The patient portal, the online applications that provide patient access to the personal health information to the healthcare provider, or you can have an interaction with the healthcare provider by yourself. With the help of the computer software or the mobile applications, you can able to have an interaction with the healthcare provider with the different places. That's why it is called as patient electronic portals. And these patient electronic portals improves the outcome of preventive care, disease awareness, and self-management of chronic diseases. That's why you might have seen this, because of this COVID disease, you have Arogya Setu. That is the mobile application, online apps, which will help you to know where the COVID patient is. What is the distance between yourself and the COVID patient? That is called as electronic portals. The patient electronic portals helps to contact the information or helps to get the information from the healthcare provider in a distance place. Here, the next you have a telemedicine and telemonitoring. And it is also the telecommunication technology which will enable the healthcare provider to contact with the patients, and again to have a one-to-one communication as well as the two-way communication between the healthcare provider and the patients, which is helps in remote patient monitoring you can have a live teleconferencing, and you can have a mobile health apps that will help you to get the information from the healthcare providers. That's why it provides health information that is collected remotely. That's why you can reach the patient who are at different places where you are not able to go to the place. With the help of this telemedicine, teleconferencing, you can reach the people with the help of the devices. Thereby, you can able to monitor the patients, you can track the patient, and you can change the behavior of the patients in terms of patient assessment. That's why the telemonitoring improves the outcome of patients with the chronic disease. The person who are suffering with the diabetes, hypertension, chronic obstructive pulmonary disease, or any other tuberculosis, any other chronic diseases, you can able to monitor the patients with the help of telemedicine, teleconferencing, and you can able to have a better outcome. That's why you have a patient data management system, PDMS, the patient data management system automatically retrieves the data from the bedside medical equipment. You have a patient monitor, ventilators, you have a syringe pumps or disinfusers. From the medical equipments, the information is retrieved with the help of the software. Thereby, you can able to get the information at your central monitor. Then you can able to go for the proper prescription of treatment and the treatment strategies. Then the electronic health records. This is the new version most of the corporate hospital is now following. That's a digital version of patient data. The healthcare information of the particular patient is kept in electronic methods. The digital format, all your informations are available. That's why nowadays the MRD section, keeping the records in the papers or in the files is not practiced nowadays, but most of the things will be making in the form of electronic version. You can able to have a retrieval of data anytime, anywhere, any place. That's why these electronic health records improves the accuracy as well as the clarity of medical records and the information. Thereby, you can able to get retrieve. Hello. Network illa chalo.
Sir.
Yes, no, some technical difficulties was there. That's why I could not able to complete it. Another only few slides are remaining. You can start now again.
Yes, sir. Sure, sir. Shall I make you as an host, sir?
Hello.
Yes, sir. Shall I make you as an host, sir?
Yes, yes. Can I start now?
Yes, sir. Please.
Okay. Yeah, after this telemedicine and teleconferencing, we had a electronic health record. Because this electronic health record, it is the digital version. Already I told it's a digital version of the patient data, which is used for the patient care delivery or patient care treatment. And then finally, what is the uses of technology-based care? What is the role of nurses? The technology-based care, the important role of nurses, there are 4 areas the role is there. First one is the policy. The nurse who is providing the direct patient care, she should involve in setting the as well as evaluating the institutional, organizational, and public policy related to the technology. And the second aspect is the quality and safety. As a critical, as a patient care nurse, see, we should ensure that the technology we use will meet the international safety standards and quality. Then third aspect is the access. We should ensure that the institutional decisions are made with their input of other stakeholders. And we have the next aspect is the use. We have to make sure that we are involving the institutional policies and procedure related to the maintenance, training, monitoring, and reporting of adverse events related to the technology. This is the 4 important roles we have to consider when you are following the technology-based care. The next we have the benefits and the drawbacks of technology-based care. The important benefits is that improved accessibility, because every patient, every individual will have access to the technology because of these advanced technology, softwares, and appliances. That's why the improved technology is the important benefit. Then second one, we have a decreased human error. When you are using the technology-based care, there is a chance for minimal human error, that the human error will be controlled. Then there will be a positive impact on nursing shortages. Thereby, because the human resources will be taken over by the technology, that's why you have to have better benefits. Then the drawbacks is that there will be a threat to the human element, and there will be a general divide, because the people will not have a bit of changing technology, accepting the technology. The resistance to change is the important problem what we have in that drawback. Then we have a data and security threat. There will be everything, if you go in the form of technology or electronic records, all these things, there will be always there is a security threat. That is also the another important drawback of technology-based care. And summary, when to conclude the session, the change and the technology, these are the 2 important constants Yeah, we will. No, sharing complete over now. Yeah, I have completed my presentation, madam. Yeah, PPT share कर सकते हो?
Desktop में है, desktop में। Desktop में रखा था सर।
So kindly unmute yourself, sir.
कैंडल भी उधर ही लगाया है। कैंडल लगाया है। PT सर PPT का है। So kindly unmute yourself, sir. हाँ सर wait. हाँ आपको मालूम है। हाँ
Next one.
कैसे वो क्लोज करना है सर। अभी
Yeah, means with this we have came, then finally we have the use of technology based care. And what is the nurses' roles? If the nurses are playing in 4 areas, they are playing the role. First thing is the policy. Means the nurses providing direct patient care, they should involve in setting and evaluating the institutional, organizational policies related to the technology. And she should ensure that the technology they use meet the international quality and the safety standards. And she should make sure that everybody is getting the access to the technology, and we have to see that if we are using the technology with the proper training, monitoring, and maintenance. These are the benefits and drawbacks. Benefits already accessibility, and there will be chance of human error, and there will be the drawback is always there is a threat for the human element, that is a human resource. There is always a threat because of the technological taken over. Then there is a generational the resistance to change. There is a chance for the security threat in relation to the data and the information. To conclude, the change and technology are the two important things in today's world, which we have to follow it and we have to accept it, and we should not go for resisting the changes. And many studies have shown that more than 82% of nurses believe that the technology has a positive impact on the patient care. And again, it is our to use because of the population and shortage of human resources, you need to use the technology in your daily practice. And again, it is very important to right balance between the technology and the professional nursing to make sure you are using the technology in the effective services in the better. Yeah, this is my references which we have used for presenting this presentation for the reviews. And thank you, everyone. If any participants has any queries or any questions, then I will be happy to answer them. Yeah, now over to
Thank you so much, sir. Thank you for your valuable and informative speech, sir. Thank you, sir. Thank you for your valuable speech, sir.
okay, thank you, madam. This again regret for the technical difficulty during this presentation.
There are one or two technical difficulties. Once or twice I think, Sir Balan, how are you? I'm Dr. Muttami Shelvi. You are the product of Annapurna, no? Hello?
College of Nursing. My Samundeshwari is my classmate.
Samundeshwari is your classmate. And, I'm supposed to have this topic, supposed to have Selvanagi as resource here.
Okay, ma'am.
And finally, madam said, madam is busy with some other schedule right now. Our institution is moving for NAT, no? So she has some other schedule there. And moreover, the research workshop this week they are conducting, I think.
Okay.
There is no time for that. So luckily you entered in that session right now.
No, thank you.
Replacing your madam, you entered.
Okay. Thank you, madam. Because we are working in a little remote rural area. That's why we had a more difficulty.
No issues, because the range issues everywhere it is there.
Yes.
We were having a person to discuss some the same topic. That is enough, I guess. Probably a student should have received the message what you want to convey. Thank you so much. We'll meet in person when time.
Yes.
God permits us.
No, God will permit us, madam. No issue. We'll be there. We'll meet.
We have to make ourselves to meet. But
Yes.
not in this pandemic, no. Definitely we'll meet. Once the pandemic over,
Yes.
we'll be planning some sessions, no, in direct and physical presence. That time we'll meet. Definitely. Okay, all the best, Mr. Balan.
Yes.
Somebody is discussing about it. Okay, next.
And this is the most awaited moment for all the students. We are going to announce the prize winners of poetry competition. The third prize goes to SM Keertana from BSc second year. Now over to Keertana. Keertana, now you can read your poem. SM Keertana, you hear me? SM Keertana.
Yes, ma'am.
Over to you now.
Good morning to all. I am SM Keetman from BSc Nursing second year. The poetry theme is transforming nursing practice, improve care. Nursing is art of helping and miracle of hope. Nurses are the open the eyes and of a newborn and closing the eyes of a dice one. You cared for the sick and held many hands through your love. You made people to laugh through your love and caring. You saved our lives, loved ones' life, given comfort and taught us how to love our loved ones and ourselves. Because of you, we lived in the happiest and safest world. Hands that turn into care, touch that turns into comfort, smile that turns into healing. Nurses are the living angels. Thank you, ma'am. Ma'am.
Thank you, Ms. SM Keetana. The next prize winner, the second prize goes to Priyadarshini from BSc first year. Priyadarshini, now over to you. Priyadarshini.
Yes, ma'am. I am Priyadarshini, BSc Nursing. Poem. They are strong yet have the gentlest of touch. They walk with determination, but also take time to listen. They are education, teaching, and sharing knowledge every day. They are when you need them in most. They are nurse. Thank you, ma'am. Ma'am.
Thank you, Priyadarshini. Thank you. And congratulations. The next first prize goes to Ganeshri from BSc first year. As she is not available, we'll be going to the prize winners of poster competition. For poster competition, the first prize goes to Durga Devi from BSc second year. And the second prize goes to Krishna Veni from BSc second year. And the third prize goes to Abhirami from BSc second year. And the special prize goes to Samyukta from DGNM second year. We'll be displaying the posters for your view. Thank you. Next, over to vote of thanks.
The best and beautiful things in the world cannot be seen nor even touched. They must be felt by heart. Thank you is one such brave among them. I deem it a great privilege to propose a vote of thanks to all the dignitaries who have witnessed it as a memorable event. So today my words are not enough to express gratitude on behalf of our college. I wish to express my gratitude to our chief guest, Ms. Larry, with a wing in administering the college. Grandmama, yes, she is.
அகஸ்டிங்க உனக்குன்னா இங்க வேலை இந்த குரூப்ல மரியாதைட்டு போ.
Dr. Rebecca Hans, nursing research. Thank you for being a part in this program. I take immense pleasure to extend my thanks to our special speaker, Mr. Principal of Lakehurst College of Nursing, Mangalore. And I would like to take this opportunity to express my hearty thanks to our grand persons, Dr. T. Sivalan, Principal and Dean College of Nursing, BK, Maharashtra. Thank you, sir, for taking part in this moment. And I tell you what my gratitude to your woman for excellency, innovative thinker, and also behind the scene of all our occasions. She's none other than I believe Principal Dr. G. Muthuchalvi for her all words of wisdom that radiate some energy with and wisdom. We will ever remain grateful to you, ma'am. I will wish to gratitude to avoid Principal IQAC Coordinator Dr. V. Sasi for providing the encouragement and to your support. Thank you, ma'am. And special thanks to Mr. Samandeshwari ma'am and Mr. Prabhu sir and Mr. Pakishwari ma'am and Ms. Soumya ma'am to arrange this. I would also like to wish all success to the students today on this special occasion on behalf of PMCon family. Lastly, I extend my thanks to our beloved students of PMCon for their participation in the special occasion. Once again, I thank you all for getting the special occasion. Thank you to all.
Thank you, one and all. Thank you for being with us. Now the meeting ends.